Why is a safe return to exercise important after injury?
Returning to exercise after an injury requires care to avoid setbacks. Rushing back too quickly or overdoing it can result in re-injury or chronic pain. A gradual, structured return helps rebuild strength, flexibility, and confidence, ensuring your body heals properly. Prioritizing safety can make your comeback more successful and sustainable in the long run.
When should you start exercising again?
Wait until you have medical clearance before resuming exercise. Consult your doctor, physical therapist, or healthcare provider to confirm that it's safe to start moving again. Signs that you may be ready include minimal pain at rest, reduced swelling, and restored range of motion. Everyone heals at different rates, so listen closely to professional advice and your own body.
How should you structure your first workouts?
Begin slowly and focus on low-impact activities. Start with gentle exercises like walking, swimming, or cycling, and include dynamic warm-ups and stretching. Pay attention to your form. Stop if you feel pain, and gradually increase intensity and duration over time. Using a log or journal can help track your progress and spot any warning signs early.
What warning signs should you watch for?
Watch for pain, swelling, or instability during or after exercise. Sharp or persistent pain, increased swelling, redness, or a feeling of weakness are signs you may be pushing too hard. If symptoms return or worsen, stop exercising and consult your healthcare provider. Recovery isn't always linear, so patience and self-awareness are key.
How can you prevent re-injury?
Focus on strengthening the injured area and practicing proper technique. Gradually introduce sport-specific exercises, maintain good overall fitness, and avoid skipping warm-ups or cool-downs. Paying attention to posture and body mechanics and working with professionals like coaches or therapists can further reduce your risk of re-injury.